Welcome to the Doctors Making a Difference podcast, where we help physicians to be empowered with the tools they need to be successful in medicine, in finance, and in life. Join us as we highlight doctors and other professionals around the world who are making a difference. Today, we are privileged to have Dr. Scott Abramson here. I'm so glad you've been able to join us, Scott. He and I have been talking a little bit off mic before about his story, and it's fascinating, and I hope you'll look forward to hearing from it. So, Scott, would you mind introducing yourself to our audience today?
Sure thing. And thank you for having me, Peter. My name is Scott Abramson. I was a neurologist at the Kaiser Permanente medical system in Northern California in San Francisco Bay Area. And I worked as a neurologist for over 40 years there. I started in 1979 and I retired in 2020. So it's a cool thing that when you think about it, a lot of doctors work over 40 years, but I worked parts of 6 decades, like 1977 to 79, 80s, 90s, 2000, retired in 2020. So it's Ted Williams. He started in 1939, the great baseball player for the Red Sox, retired in 1960. So he played parts of 4 decades. Now, the other thing that I really want to say is that I was there for 40 years, but the last 20 years that I was there, I was one of the champions of our physician communication mission at Kaiser and our physician wellness, health and wellness mission at Kaiser. And that became really my passion when I was there.
It's neat. I think it's really interesting to, like you said, span across multiple decades. And my observation is that it seems like a lot of people don't make it that long. In other words, their career in medicine is really curtailed because of the challenges of medicine. So it seems to me like a lot of people plan on working for maybe 15 years, 20 years, and then they hope to find a way out. So the fact that you did it for 40 years and continue to serve patients and continue to serve your colleagues for that long is remarkable. And I applaud you for it. I think that's wonderful that you have that legacy.
Yeah. And Peter, the thing is, I retired when I was 72, and most doctors at Kaiser, they do. Well, you get a great retirement plan, and you can start retiring when you're 60 years old. And a lot of people take that 60 and out. It's a great retirement program. And they kept asking me, why are you sticking around? You could retire, it's you're 72. My God, take the package, go. But the thing is, because I had been involved and learned so much from that physician communication mission and from that physician health and wellness mission, that's what kept me going. If it wasn't for that, if I was just doing the nuts and bolts neurology, find it, fix it, explain it and all that, I would have retired early too. But that's what kept me going, the extra years. As a matter of fact, I probably would have still been working, except my wife said, I either retire or she divorced me or she'll kill me. But I figured retirement was probably the best thing to do with given those choices.
It's neat. So you found a way forward. And one of the things that connected you and me is you wrote a book. And so you've been able to accumulate lots of patient stories. This book, if those that are watching on video can see, it's called Bedside Manners. And yeah, tell us about your book. I've been able to read a bunch of it here since you sent me a copy, and I've really enjoyed it. But tell me what led to this book and why you wrote it.
Well, as I mentioned, those last 20 years, I was involved with physician communication coaching and physician wellness. And every month during those 20 years, I would write an article for our Kaiser physician with 10,000 strong Kaiser physicians in Northern California. And it seemed so many things would happen, just something a patient would say, something a colleague would say, something the way that I would be in a situation and I would feel. And I'd say, you know what? I bet other people feel like this. I bet I learned a lesson from this patient. I learned a lesson from this conversation with a colleague. Maybe others could learn from that. And so it's basically just these articles that are just culled together after 20 years of accumulation.
You're quite a good writer. And as I listen to that, because I think about stories that I come across every day, a patient said something or some funny little thing that a person had, or you receive a compliment for something that maybe you didn't even realize was helping somebody or making a difference, but that's the thing that meant the most to them. Or there was one story you shared where you went to a funeral of one of your patients and it meant so much to the family members. And I
Yeah.
just never write it down. I was thinking like, this is quite a remarkable thing that over the course of all those years, you kept maybe not a journal, but a living legacy of these stories because they were written down. And so I want to hear the background. How did you become a good writer? And what made you start doing that? like say 20 years ago?
Well, I'm going to show you the secret right now, Peter. I'm going to put it on the screen so your viewers can see it. This is the secret.
Okay.
I carry this around with me. I put it by my bedside at night. I'll wake up at 2 in the morning. And if a thought comes to me, maybe something that happened that day in the clinic, 2 in the morning, I'll wake up and I'll write it down
Yeah,
here.
so I gotta tell the most people are probably hearing this on a podcast. So it's a
Well,
little spiral bound 60-sheet pocket-sized, notebook, and
yeah.
so you kept that with you, and so whenever a thought or idea would come to your mind, instead of saying, "Well, I'll write that down somewhere down the road," you just grabbed your pencil or pen and wrote, some notes on it right then and there.
Exactly, and 'cause at 2 in the morning, and you say, "Oh, I'll go to bed, I'll wake up, I'll remember." You're not gonna remember it, you're gonna I knew there was something at night. The other thing is my process is not really, being a writer. I do work at the writing because I have to try to make it as literate as I can, but I'm not a natural good writer at all. I've never been. But the way my writing process worked is telling a story verbally. So something would happen, and I'd tell someone, I'd come home and tell my wife or something. I'd tell the story, and then I'd tell the story a few times. And by the time I got the story, then I would write it down. So it was really a process verbally that then got transferred into paper.
Yeah, and then the more you did it, I'm assuming you got better at it, but the
Mm.
stories are really good, and the book, like I say, encourage people to pick it up. It's Bedside Manners for Physicians and Everybody Else by Scott Abramson. And
Yeah,
the interesting part about the stories is they're not like 10 or 15-page stories. They're 1 or
no,
2 pages. They're little snippets and just
yeah,
an insight into a life of a physician and your interactions with patients over decades.
yeah, exactly. Yeah.
Go back a little bit to the Scott Abramson in the early career years. Did you write stuff back then, or what's your background? Did you have any kind of writing background in your undergraduate years or anything like that?
No, I didn't. No, not at all. Never wrote anything.
What led you to neurology? Again, you started off years ago in medical school and decided to become a neurologist. I'm interested in your story of how you became that.
Just to back up, the neurology part was, I don't know, sort of serendipitous. I actually, after medical school, I did 1 year of psychiatry. I thought I was going to be a psychiatrist, but I was really, realized I was too screwed up for that.
Oh dear.
So I thought I'd better do something more concrete, and I went through the neurology residency there and a neurology month of rotation, and I had some good mentors, and that's what drove me. When I hear people, on your podcast and other podcasts, and the question is, why do they go into medicine? And I'm really in awe of these people because gosh, I love science. Ever since I was 5 years old, I got a doctor's kit. I couldn't wait to put a real doctor's kit on. And I love physics and I hated all that stuff.
Oh really?
Yeah. So I was never that good at all those sciences. I like things like history and I like reading and stuff like that. So I was never like a natural scientist or that part never appealed to me. I guess when I think about why I went into medicine, I think of this. One thing is my father was a traveling salesman, sold
Mm,
vacuum cleaners. And then he was always would tell me, don't beat your brains out like me. Get an education, have a profession, be a lawyer, be a doctor. And of course, growing up Jewish, that is the sort of the big thing to be in the medical profession. That was
uh-huh.
very prestigious kind of thing. As a matter of fact, I remember once we had this physician wellness kind of workshop, and they asked everybody to draw a picture about why they went into medicine. So I found myself just drawing this picture. And here was the picture. It was this picture of this big guy, this big rough guy with a football helmet on, and his name was Biff. And then there was this beautiful blonde woman, and I was in between them, this kind of a scrawny, spaghetti arm kind of guy. And the bubble thing from this beautiful girl named Joanne, she's saying, "Yes, Biff, you are big and strong, but Scott is going to be a doctor." I think a lot of people maybe being nerdish in a way and so forth, that this was a avenue for prestige and feeling important. Although, okay, I still had visions of saving the planet and healing humanity and all that. But so it was a combination of those things. That's what got me into medicine.
Well, it is interesting as I talk to people all over the place. Everybody has a little bit different story, but once you get into it and you realize that you're serving patients and you're helping them, most people, at least at some point in their core, want to help people. They want to make that difference for a person. They want to help, like you said, save the world or make this tremendous change. And thinking about your career, it's quite interesting. Like you said, you spanned several decades, and neurology has just changed leaps and bounds during that time. I think of that whole idea of anything to do with our brains, anything with neurocognitive sciences. There's still so much to learn, but over the course of your career, I'm sure you've been able to see like breakthroughs and forward leaps that you would have never envisioned at the beginning of your career.
Yeah, that's true. I mean, the MRI scan has revealed so much and all the technology and so forth. But the reason, I'll tell you, the reason why I really loved neurology was not because of all the technological advances, but because it seemed to me you could that you could still make a difference in the exam room before you got all the tests. Because so much of neurology, I think, depends on getting a history, understanding people, and also your physical examination, because that tells you where to order the MRI scan and so forth. So much of neurology still, in spite of all the technological advances, maybe AI is going to change stuff, but it's that one-on-one patient doctor interaction that still makes things, so impactful.
Yeah. I think a lot of people reflect on AI because there will be the in the future, like my children will grow up in an era where information is immediately accessible and AI can connect the dots on a lot of that information, but it won't replace the healing aspect of you putting your hands on somebody and helping. The second piece of it, it really is that exam finding. The neurologists, in my experience, do the best physical exams, like so detailed, so thorough, and I'm just my exams are shameful compared to a neurologist exam. And so I think it's really neat. Like you said, you can pinpoint this is the nerve pathway, this is happening, and we can devise a treatment or order a test based on that really specific detailed exam.
Yeah, yeah. There's still, I think we still, in neurology, we still have it a little edge over for the AI stuff,
Oh yeah.
hopefully.
I think so. The if our specialties depend on only on pattern recognition and assimilating data,
Yeah.
AI is going to have, I think, some of a what of a disruptive change in that. And I don't know how it'll be. I think there still will need to be physicians in every realm because it's not just about information connecting dots. It is about making those connections with human beings. And I would much rather, I like to talk to people face to face and make those
Mm.
connections. And I think most people will still find that healing forevermore, even though we have technology that makes it so we don't have to memorize lists or it's maybe not so useful to have a list of things memorized in your head as it once was.
Exactly, exactly. And that's what brings, I think that's what can bring us so much joy and meaning in our professional lives is when we have that interaction with patients.
Yeah. Did you find I was curious on for someone that worked for multiple decades like you did you find after a while that you were seeing just like as far as the medical side of it, you were seeing repetitions on a theme. You'd seen it thousands of times. I was curious, how did you find yourself still engaged? Because sometimes people will say, boy, it's new to the patient, but I've seen this 1,000 times in my career, and maybe it's a little bit boring, or maybe it's not quite as academically interesting. How did you remain engaged in that process?
Well, that's such a great question, Peter, for everybody, I think, engaged in this. If I hadn't taken this communication mission and the communication mission and that I would have been stuck in the, okay, find it, fix it, explain it type of mode. I th- let me try to explain this. If I could boil down our communication mission that we had, if I could boil it down to one word, that it would be a very simple word, and you would never guess it. The word is the.
Hmm.
That's what makes the difference in communication. And I explain what I mean. And after thinking about this a lot, so traditionally we go in and we see a patient, and what's in our mind is what's the matter? What's the matter? Where are you hurting? How long has it been hurting? Which, is it on Thursdays, Tuesdays? When does it hurt? We do the exam, we do the history, the physical, we make a diagnosis, we give treatment, so forth, and that's it, out the door. What's the matter? I mean, I'm not saying you don't have to do that, But what the communication mission had taught me is if you get rid of the THE and you boil it down to what matters. So someone comes in, let's say, with the typical tension headache. Okay, you see a million of those. I'm sure you see them too, right? And you could say, what's the matter? Okay, maybe you're stressed out. Maybe you got allergies. Let me give you this. Let me give you that. But if you approach this and you say, what really matters? And so one of the questions you might ask someone in this situation is, tell me, you've been having these headaches? What are you most afraid of? What do you fear? And maybe you might get something like, when I was in my 20s, I had the venereal thing, and maybe that could be, I heard about these infections going to the brain. Maybe. And that's what really matters, not the headache itself, not the pain of the headache, really, but that. And if you could address that and you could say to that person, hey, this, I can assure you, I've examined you. There is nothing bad like that. This is nothing bad. Now, that person goes out of the exam room and it's going, thank God. I don't have to wake up at night thinking about these little spirochetes or whatever they are going around in my head. I can rest at night. My wife can rest at night. And as a physician, when you make a connection like that, you're thinking to yourself, man, I did something good today. I really relieved someone's suffering, someone's worry. On the other hand, if it's just another run of the mill tension headache, okay, here's some Elavil or something like that. Tell me how you're doing in 2 months. It's not going to be very meaningful or joyous. So that one word, if you can get rid of that one word and focus on what matters to people, that can bring so much joy and meaning into your professional life. And that is how, you know, those run of the mill backaches and headaches, tingling all over and gurgles here and there, that's how it remains meaningful.
I like that. That's an interesting way to put it. I know I've told patients hundreds of times. We often focus on the what, but really we need to get to the why. Why is this disease process happening? But then also, why does this matter to you? Why is this important? In what way is it actually affecting you in a way that it is meaningful to you? And the most challenging thing on this, Scott, is time. I found that the hardest thing. Maybe a question to give you is: you're a busy clinician. You've got so much going on. There's 10 people waiting for you, and yet you need to be able to take the time to dissect that and say, why does this matter to you? Get rid of the the, and say, what's the big matter? What's the underpinnings of this? How did you manage that in a complicated clinic, in a complicated, busy life?
I can assure you, when you use these communication techniques that we used at Kaiser and other places use the same thing, you actually save time. You actually save time because let's say that patient that comes in, okay, you could, most patients that come in within about 30 seconds of their history or reviewing their chart, you got a pretty good idea what this is
Mhm.
or where you're going. My approach was, I would ask a few general questions maybe about this and so forth. And then I'd say, now, before I ask any further question, let me ask you, what are you most worried about? Or I might ask, how does this affect your life? Or what do you think is the problem? And maybe they think this problem is a aneurysm or something. Then I know what I have to do. And I can really curtail all the other stuff and just focus on reassurance about the aneurysm. Because if you don't address those things, if you miss those things, you're going to get a call back. Doc, the medicine ain't working. Or doc, I need another appointment. Or let's have a conversation about this some more. I'm still hurt. But if you can find out what matters and you can address that, you're gonna save time, and you can save time in the exam room and for all the after stuff.
That's a great clue. I love that. So within, just to restate it, within that first minute, you would ask, why does this matter? Or what are you most worried about? Or what do you think this is?
Yeah, no, though I think those are 3 great questions. 3 great questions to ask people, and not depending on how you think things are, but what do you think is causing it? How is this affecting your life? And what is your worst fear about all this? And you may not need to ask all those questions, but one of those question. For instance, I'll give you an example here. So I'm, surprise, surprise, I'm running late in my clinic, right? And so my nurse bangs on the door and she says, Abramson, you better get out in the waiting room. Your 2:30 patient is creating a ruckus out here. And I walk out and there's this guy he's got a Ford Motor Company hat on. He's about 50 years old. And he's to the whole exam room. He's going, I ain't waiting. I'm losing money. I ain't waiting. I'm losing money. Okay. So I had this conversation with him in the exam. Lots of patients are around there. And I'm saying, okay, I'll be with you in 30 minutes, sir. I ain't waiting. I'm losing money. Sir, how about 20 minutes? Sir, I ain't waiting. I'm about 15 minutes. So, I'm sitting here with a room full of patients and I'm dickering with a lunatic. And so finally he comes in and he's about as happy to see me as I am to see him. It turns out he works at he was parts manager at Ford and he's got this back pain and he's had this back pain for a while. But amazingly enough, he doesn't want time off work. He doesn't have a legal claim. He doesn't want narcotics. And I'm thinking to myself, what does he want out of me? And I hate to be cynical. So, and I'm going and I'm thinking, okay, I'm going to go through all the things, the whole history of the back and this and that. But before I do that, I remember my training in this. And I remember one of the questions to ask people is, how is this affecting your life? And so I said, before I ask anything, let me just ask you something. How's this back pain? You're still working, you're doing everything. Don't want time. How's it affecting your life? And he says, to me, he says, I have a 12-year-old son and I can't play catch with him. Now, when he said that, it reminded me a few years earlier, I had a nerve problem in my arm and my son was about 12 years old. And that was one of my great fears that I'd never be able to play catch with my son. And so we talked a little bit about the back pain. I didn't have any magical cures, but we talked a little bit about baseball. We talked about having sons. We talked about playing catch with our sons. And I can tell you that we both left that exam room with a feeling of connection with another human being. And I know, like I said, I didn't have any magic cures, but I know he left there feeling that someone heard him and someone saw him. And I left that exam room feeling, you know what? I think I did something good. It wasn't just a chronic back pain that maybe I get given some new medicine for, Neurontin or whatever. But man, I felt good with that connection. I felt I had really connected with another human being. And that's the kind of thing that brings joy and meaning into our professional lives when we can connect like that, even with the routine run-of-the-mill chronic back pain, chronic headaches, chronic tingling all over type of patients is making that connection. And that's why we still hopefully have an edge over AI. AI couldn't do that.
All right. And think about the encounter you just shared. That is in the book. I remember reading that story. And I
Uh,
was going to ask you about that. So I'm glad you brought it up.
uh,
That is a kind of a difficult patient encounter, but you were able to diffuse it, find out what actually mattered to this gentleman. And even though you didn't have a ready solution, just the fact that he was there and you had a connection and he knew that he was listened to and you hoped that you could offer something that would actually help him have less pain, et cetera. But that's more the what. You focused on the why and you made that connection in a way that stood out for you and I'm sure for him as well.
yeah. And not only that, but because we had that connection, and it's talking about saving time and so forth, they helped him. Because we had developed that degree of connection, degree of trust, whatever I'd given him, or suggestion I made, he's going to be more likely to follow it.
That's true. Even the power, even if it was something that wasn't that effective, placebo studies show that if the
Right.
patient really believes their doctor that this is going
Yeah.
to work, they're much more likely to have a benefit. And so that should be even more amplified in our studies that show things that are effective. And if the patient, I trust Dr. Abramson, he's not going to give me something that's a bad idea. You're more likely to actually derive benefit than if you're like, oh, that guy was late and he didn't pay
Yeah.
attention to me. And why should I even try this? People do get a different level of healing when they feel like they've made that connection.
Exactly, exactly. And again, what it brings to us as physicians, it brings that joy and meaning that so many of us, it seems, have lost.
A related question to this, the word burnout. gets used so much. I think it gets overused, but it
Yep.
represents the idea that folks feel like they don't have anything else to give. They're empty, asked to do so many clinical tasks or so many prior authorizations or so many things that don't really bring me fulfillment and joy. And then they want me to work crazy hours and be responsive at all times. And people feel empty or maybe they feel disengaged. And so I'm curious what your experience is over your career span of seeing that come to light. And if you ever had any of that with you or your colleagues and how you manage it, just any advice you would give us regarding burnout.
We all have bad days where we just don't want to get up and go to the clinic and all that. We all have bad days, but I think burnout, you're right. I think burnout may be overused is we all have the bad days, but when it's persistently bad, maybe that's what people are talking about burnout. But Peter, I'm so glad you asked me that question because I have been thinking about this. I have talked to a lot of doctors who seem to be going through it. I know I've had bad times too. Let me try to give you my perspective about this. So when you read all these blogs and people are talking, they talk about burnout. Okay, burnout. What is burnout? Burnout is moral injury, they say. Okay, so here's the crucial question. What do you mean by moral injury? What do you mean by moral injury? And I would submit to you that what moral injury means is that our behavior, our actions as physicians don't match our values. We have these gray ideals. We're going to save the world. If you look on Kaiser, we have a homepage that it tells your philosophy of medicine. It says, I trained here. I believe in excellent patient care. I believe in compassionate medical care. I believe in treating everyone as family, right? Those are our values. But what happens, and I believe that burnout is based on two myths that tell us that we can't, that and this explains why our behavior, our actions as physicians don't match our values. The first is we have this idea in our heads, I do it right. I do it right. All my life, I've achieved. If I brought home a C in middle school, it was a family crisis. I aced my pre-SATs, my SATs, my MedCaps, my match day, everything. I had one of my colleagues tell me, she said, I was raised to be an Asian perfection machine. Really, we memorized the Krebs cycle, for God's sake. But here's where it comes in, so we have this ideal that I do it right. I give excellent care. So my own experience, and I could give you 1,000 instances. So it's a Friday afternoon. I get a call from a family of a Parkinson's patient. The guy's not doing well. They want him seen. It's a Friday afternoon. I just couldn't do it. I couldn't see him. And so I had my nurse. I said, call him and tell him to do this and that, and we'll get him in on Monday or something. But if I was really giving excellent care, if I was really treating everybody like family, I would be seeing that guy on that Friday afternoon. But I couldn't do it. And it happens again and again. And when that happens, it takes its toll. It takes its toll because our actions don't match our ideals. What we do just can't match it. So that's the first myth about burnout is that our actions don't match our value. The other thing is I give excellent care with compassion. I'm a compassionate guy. That's why I went into this field, right? I love healing. I love people. So thinking about that Parkinson patient, and I could give you a lot more examples. So here's what I'm thinking. I'm angry. I'm angry at this family for calling on a Friday afternoon. I'm angry at Kaiser for the way they schedule my appointments. And I'm angry at myself for feeling angry at all this stuff. To tell you the truth, I'm feeling a little annoyed with God for making all these people with a defective basal ganglia. So that's the deal. I know I should be feeling compassion. I'm a compassionate guy. That's why I went into this. I want to help people, but I'm not feeling it. I'm just feeling angry. So that's the other aspect of this. Why burnout? Our actions don't match our ideals. We don't do it right. We don't do it right all the time. We're not Asian perfection machines like we were raised. And we don't do it with compassion. We don't do it with compassion either all the time. And that takes its toll. That is the moral injury, I believe, is that paradigm.
Makes sense. So, what would you recommend for folks, in our career? Most people listening to this are either in training or mid-career, or maybe they're late career. What would you tell someone who says, "I am not just someone who had a bad day. I'm someone who feels like my career needs to change. I have to switch to something else because I can no longer find joy in this because everything seems empty, or I feel like I can't be the level of doctor that I thought I would be, or I can't have compassion." What advice would you give?
And here's what I have tried to implement in my own life. It was a struggle every day to do this, but I had to try. And I would say that the answer is what I would call mindfulness self gratitude. Mindfulness self gratitude. And let me just explain what that is. And I think I wrote some of the stories in the book that sort of emphasize this. I'm not afraid of flying, but whenever I'm on an airplane, I always have a reasonable appreciation of being in a 30,000 feet up in the air and what could go wrong. And that's why whenever the plane lands safely, I always thank the pilot because at that moment, he's my hero. But to the pilot, my sort of run of the mill routine thank yous are probably nothing special. He probably gets 1,000 of those every day. They don't mean anything to him. So if you apply that to us as physicians and healers, we land people safely all the time. Runny noses, GI upset, skin rashes. We land, and when they give us their routine thank yous, we probably think it's nothing special. But if we did think it was something special, if we took those thank yous to heart and realized that we really were helping people, that's what I'm talking about is being mindful of the gratitude that people show. Let me give you another example. And this happened maybe 35 years ago, or even longer, maybe even 40 years ago. Okay. So one Sunday night, I'm shaving. I usually shave at night. And I noticed this mole like thing on my face. And I had this instant recognition that this was malignant melanoma. I just knew it. And so that night, I walked up and down the shoreline where we lived all night long. And I was thinking that night, what what I'm going to do in the last 6 months of my life. Who's going to take care of my son? Who's going to play catch with my son? Who's going to come to my funeral? What are they going to say? And I'm thinking about all this son. So the next day I make an appointment, a routine appointment to see the dermatologist on call, and I'm going to get my diagnosis is going to be confirmed. So the dermatologist was a guy named Dr. Gary Deck, and he was on call. He's seen all the walk-ins. Comes to me, looks at this mole-like things, takes a scalpel out of his thing, takes the scalpel to the mole, and he says to me, "Just a blood blister. Take care, buddy." Now, at that moment, I felt such gratitude for Dr. Gary Deck. He had given me my life back. I wanted to fall to my knees and kiss the hem of his Kaiser issue lab coat. But I wonder, what was this like for Dr. Gary Deck? Did he get satisfaction from this? Did he feel like a hero? Did he feel like he did something special? I don't think he did. It was just bust a blood blister on some neurotic colleague and off to the next patient. But what if he did? What if he did know how I was feeling and know what he did for my life? He, the thing is, he deserved to feel like a hero because he was one to me. And all of us healers and physicians, we are the real life heroes to so many people. We're like Superman and Batman. We're the real life heroes. Don't we deserve to honor ourselves as real life heroes for doing all this stuff, for popping blisters, for helping skin rashes, allowing people to sleep at night? We deserve to feel like heroes, but we don't think it's anything special. But what if we did? Wouldn't that bring joy and meaning back into our professional lives? Wouldn't that be one way we could match our values to our behavior just with the mindfulness that we have done something good just in these routine, ordinary, mundane, run of the mill, blister popping stuff?
So
So,
it's like the idea that you intentionally, mindfully think about gratitude, both gratitude you give and gratitude that you receive, whether it seems like it's run of the mill or not.
yes, being aware just of those everyday things that we do and realizing that we are making a difference in someone's life and feeling and knowing that and incorporating that gratitude into our mindfulness. If we can do that, because you're seeing one patient after another, chronic back pain, chronic ear pain, chronic this, chronic that, it's run of the mill stuff. But how often do we actually feel gratitude? I mean, feel that we're doing something special. There's another story in there. There's a colleague of mine who's one of these really go-getter types. He's 54 years old. He jogs like about 6 miles every day, truckloads of alfalfa sprouts and everything. And so one day he blows out his knee. He was devastated, but he realized, that these sort of things happen and, things could have been worse. But because now it meant that he was now vulnerable and his body was vulnerable. It's devastating for him. But being the type of guy he was, he's going to go through surgery. They do the surgery. Everything came out fine. And he is going to come back bigger and stronger and better than ever. So the time comes when post-operative and so forth, and he goes, and it's his first day of physical therapy. He can't wait to start physical therapy. It's 7. First thing in the morning, he's sitting in the waiting room. The physical therapist comes out and he has a clipboard and he looks at the clipboard. He looks at the guy and the physical therapist says, "So you're my 7:30 patient." The guy says, "No, I am not your 7:30 patient. I am the guy to whom you're going to give his life back. I'm the guy." And what if we as clinicians and physicians and healers had our mindset that every person that we saw, we were going to give a little bit of their life back, maybe just helping someone get rid of a rash that's keeping them up at night, or reassuring someone that the cough is not a cancer. I'm not talking about doing CPR or curing cancer or anything, but just those little things. If we had that mindset that I am going to give this patient a little bit of their life back, and maybe it's just by reassuring them or something, or maybe just give them a pat on the back. You're doing good. You're following direction. You're losing some weight. Your blood pressure looks good. And I told you it was a struggle because honestly, I knew that's what I wanted to do. But a lot of times people would come in and that was not my first thought. How can I give you a little bit of your life back? My first thought was, how can I get out of here in less than 20 minutes? If we did have that mindset, I'm going to give each person a little bit of their life back.
I love your wisdom on this. You've been able to do it. And like I say, you had to find a way to do this and stick with it to be able to have a 40-year career. I don't
Mhm.
know if every listener will have a 40-year career, but a lot of folks, I think, can take lessons from this, Scott. The idea that you are intentionally grateful and that you see yourself in this role of healer and look for opportunities to give back and connect with the person. And when that quick connection, my own experience as a patient and a doctor, those doctor visits, those surgeries, those interactions, everything did hinge on that 100%. When I still go to my doctor's visits, my wife always wants to know, how did it go? Because everything kind of hinges on how's that going. And I think that's really for all of us when you are in that position many times a day, you can find interactions and look for those moments of gratitude. So I appreciate you sharing that. I know our time is winding up, but are there any final thoughts you would want to leave with our audience?
I just want to get back to that team. I know when people were writing about burnout and all this stuff, that it's the EMR, it's your administration, it's all this. You got to change all your scheduling, all that. And that may be true. And if you can do that, great. But it's the change of thinking in terms of all the things that come in and being mindfully self grateful about what you've done. That's what really matters. There's a story in the Hebrew Bible, and a rabbi is talking to his students, and he asks them, "Where does God dwell?" So one of the students says, "God dwells in heaven." Another student says, "No, we can't possibly, we're only humans. We can't possibly know where God dwells." The rabbi says, "No, you're both wrong. God dwells wherever we choose to let God in." And I think it's the same thing with this mindfulness about seeing patients. It's where does the self gratitude, where does the joy and meaning come in medicine? It comes wherever we choose to let joy and meaning, self gratitude come into our professional lives. Do you remember the song by Kenny Rogers? Kenny Rogers, the singer?
Yeah.
Yeah, it's Kenny Rogers, and he had a song called The Gambler.
Uh-huh.
Okay. So there's a line in that song. It says, every gambler knows the secret to surviving is knowing what to throw away and knowing what to keep. Because every hand's a winner and every hand's a loser. And I think that defines us in our approach to this. If we take that hand, that chronic patient comes in with chronic back pain, chronic headache, you could play it as a losing hand. Oh gosh, just another patient. God, I'm behind. What do I give another Elavil, Neurontin, whatever. You could play it as a losing hand, or you could play it a winning hand. What matters to this patient? How can I connect with this patient? How can I give them a little bit of their life back? So if we have that mindset, it's up to us. It's our choice. And Peter, if I could just say one more thing about this. I listened to your podcast with this week. I listened to it with Dr. John Winkler. This was an amazing story. Gosh, it was so poignant, so touching. This physician is,
Yeah.
I don't, his, I would urge all your listeners, if they haven't heard that podcast, to listen to this.
Yeah.
It's just,
Very powerful, moving story that Dr. Winkler was so kind to share with us.
but at the opening of that podcast, you said something that just crystallizes and capsulizes everything I said just now. I bet you don't remember what it was, but I'm going to tell you, okay? Because I wrote it down. I said, this is so good. This is so good. As physicians, there's more that connects us than divides us. We have so much in common, the training, the life you get to live, the challenges, the struggles, the life and death decisions in your hands and so forth. You made that statement, and it was about how doctors connect with each other. But in that statement, it was something that was so profound and said almost with 6 words. It said everything that I just said. Do you know what the words were?
You better remind me.
Okay, I'm going to tell you. You said, the life we get to live. The life we get to live. The life we get to live. You know what? We get to choose what life we live. We get to choose what mindset we have as we do our professional life. If we want to live a life where we allow joy and meaning into that life, it's going to be a good life. But we get to live it. We have the opportunity to live it. It's not given to us. We get to do it if we approach it with that mindset. And when I heard those words, I said, that's it.
It is so true. You make me sound wiser than I am, which I appreciate, Scott. But I think the messages you've shared with us, I mean, these are like age-proven wisdom. Like people can take this through any profession, especially in medicine, and you can
Yeah.
translate it to your own career. And I just think there's so much for us to learn when you gather the collective wisdom of many physicians, especially people who've done it for a long time, and say, this is how this works. Because that level of engagement, that level of connection is what matters. It's not the what, it's the why, it's the connection, it's not the, like you said, it's the ability to make those connections and find out what really makes a person tick. And I have loved this conversation. Thank you so much for taking time to do it. I encourage everybody to check out the book. I've held it up here again, The Bedside Manners for Physicians and Everyone Else by Dr. Scott Abramson. Inspirational book and inspirational interview. Thank you again so much for taking the time to do it.
Thank you, Peter. I so much appreciate it.
Thanks for tuning into the Doctors Making a Difference podcast. And thank you for what you do to help your patients and your community. Your work truly helps so many people. We produce this content to help you have the tools you need to stay in medicine and to highlight the amazing work being done by physicians around the world. Please note that while I am a physician, and many of the guests on this program are also physicians or other professionals, the discussions on this podcast do not represent my employer or any professional organizations to which I belong. This podcast is for your information and entertainment only, and should not be taken as professional advice. You should seek appropriate professional advice pertaining to your own situation. Please check out more of our content on our website, doctorsmakingadifference.com. Also, please follow, like, or subscribe on your podcast player or YouTube channel, and give us a 5-star rating. It really helps to spread the message. Finally, If you'd like to be a guest on the podcast, or if you'd like to nominate someone else to be a guest, please visit the website or email admin@doctorsmakingadifference.com. See you next time.